which is a nonprofit, interdisciplinary, professional, and educational organization devoted to transgender health. And this is really the gold standard for us as mental health professionals and educators and parents, for pointing us in the right direction. And so these are all organizations that I'm going to be referring to, and resources that I used when I was putting this presentation together, and resources for you moving forward. So we can start with some myths. First, children may not be old enough to know about their gender identity. So that is false. And we will discuss, it's nuanced. We're going to discuss the stages of gender development and the extent to which children can be aware of their gender from a very young age. And then, of course, therapy is going to depend on the child's developmental progression. And there is still some controversy and some different schools of thoughts surrounding social gender transition in children that we'll cover. But the bottom line is that all of the research has shown that children who socially transition before puberty are typically well-adjusted. So this is a question we're going to cover a lot more of, but it is a very common myth. Another is someone is not transgender unless they undergo a medical transition. That is also false. Not everyone who identifies as transgender undergoes gender affirming medical procedures. So those procedures can range from hormone suppression in puberty to hormone replacement to surgical interventions. Another myth, if someone transitions socially as a child or adolescent, they are likely to desist or regret transitioning. You can probably guess, false. So navigating these interventions with children and adolescents especially is very complex because of the dramatic development that's happening. And there is a lot more fluidity and variability in the outcomes, particularly in children and adolescents. But an important, I just realized the myths are popping up before I'm getting to them, so I apologize. An important difference between gender dysphoric children and adolescents is in the proportion for whom it persists into adulthood. So there is a real difference between children before puberty who are experiencing gender dysphoria and children or adolescents rather, because the research shows that there's a persistence rate of about 15 to 25% of gender dysphoria in children that then continues into adulthood. And it's much higher for adolescents. So we'll cover that again. And then the last is you need to have a gender dysphoria diagnosis to be considered transgender. And that is not correct. Many, but not all, transgender and gender nonconforming people experience gender dysphoria. And certainly not all people who experience gender dysphoria identify as transgender. Okay, so transgender, we're going to start to get into some terminology. And transgender is an umbrella term that is used to describe individuals whose gender identity does not align in a traditional sense with the gender they were assigned at birth. So while some transgender people identify as non-binary, most do have a gender identity that is either male or female. And so they should be treated just like any other male or female. This is an image that maybe some of you have seen before, or you've seen a prior version of this, which is the gingerbread person. So this is the gender unicorn, and I think it is a really helpful visual, not only for us as providers, but also for families. It's really great for psychoeducation. and for kids and adolescents to have a better understanding. So gender identity. Gender identity is one's internal, deeply held sense of gender. Some people identify completely with the gender they were assigned at birth, while others may identify with only a part of that gender or not at all. So some people, and unlike gender expression, gender identity is not visible to other people. Gender expression, on the other hand, is the external manifestations of gender. So that's expressed through things like names, pronouns, clothing, haircuts, behavior, voice, body characteristics. And then there is sex or biological sex. This refers to the chromosomal, hormonal, and anatomical characteristics that are used to classify an individual as male or female, typically at birth. And then sexual orientation. So that in this graphic is divided up into those that we are physically attracted to and those that we are emotionally attracted to, both of which make up parts of sexual orientation. So many people choose to label their sexual orientation and others do not. Okay. More terms. So we'll sort of blow through these, but I wanted to put them here so that if anyone was not familiar with them or had questions about them, they could refer. Cisgender, a person whose identity aligns with the sex assigned to them at birth. Gender dysphoria is the concept designated in the DSM-5, previously gender identity disorder. And it really focuses on the clinically significant distress that an individual is experiencing. And it's important to know that, and this was covered before, but not all transgender or gender diverse people experience dysphoria. Non-binary, a person who identifies neither as male or female. And transition is a word we'll use a lot. And that's the process of shifting towards a gender role different from that assigned at birth. And that can include social transitions or medical transitions. Okay, so these two terms I think are helpful to dive into a little bit. Gender expansive. So this is an umbrella term used for individuals that broaden their own culture's commonly held definitions of gender. So that includes those with transgender and non-binary identities, as well as those whose gender is in some way seen to be stretching society's norms. So of note here, a child or teenager who might identify as gender expansive generally does not want to transition. So in fact, that's a category of individuals who are least likely to be transgender as adults. If someone is gender expansive but not transgender, then their gender does not fit within a binary, and they also generally do not meet the DSM criteria for dysphoria. Gender exploring, on the other hand, so there does tend to be a distress about the assigned sex or assigned gender expression. And so then for these individuals, gender dysphoria can be an issue. And it's unclear with someone who is gender exploring if there's a desire to socially or medically transition. I think that's, they're exploring. So a question that you might get from parents is, how do I know if my child is transgender as opposed to gender expansive? So transgender and gender expansive children often express similar behaviors, but the consistent, persistent, and insistent declaration of being a different gender is unique to kids who are transgender. So where gender expansive children might express their gender in ways that are not traditional, and they may move more fluidly along the gender spectrum. Transgender children will typically be quite binary in their thinking about gender. So one way to think about the difference is that while all transgender children are gender expansive, not all gender expansive children are transgender. Okay, so a few problematic terms that have been used in the past and are currently still used. I wanted to just put those up here. I'll just highlight a few. Transgender is an adjective, not a noun. It does not have an ED on the end. Sex change, pre-op, post-op, those terms, the issue with those terms is that they suggest that a person must have surgery in order to transition. So it's an overemphasis on the surgical piece. And as we know, many transgendered individuals never have surgical procedures. Biologically male, biologically female, genetically, those terms are reductive and they sort of oversimplify this very complex issue. So assigned male at birth or assigned female at birth is preferred. And then passing and stealth, these are interesting terms because there are some transgender people who may use these terms among themselves, and they are, it is their prerogative and they can identify with those terms, but it is not appropriate to repeat these in mainstream media or to a transgender person unless it's their direct quote. So these terms, they imply, they make an assumption, right, that it's problematic, you're passing as something you're not, or you're somehow being deceitful, when really transgender people are just living their authentic lives. And so not being perceived by transgender by others, that doesn't make them deceptive or misleading, right? That makes them authentic. Okay, so let's talk a little bit about gender development, because I'm just going to click so we have it all here. What do you think the most common question that parents ask regarding gender identity is? Is this a phase? So let's try to answer that as best we can. Gender identity typically develops in stages. So children categorize themselves in terms of their gender by the age of 2, 3. And by the age of 5, they are using gender as a category when thinking about other people and tending to assign other people into categories based on gender. And then preschool age children engage in gender stereotyped behaviors. So showing preference for gender stereotyped toys, describing peers according to those stereotypes. And what is interesting here, and then you see where gender stability comes in, and then gender constancy. And then research has shown that about 80% of transgender adults knew their gender identity before the age of 10. And 96% knew before the age of 18. So those are pretty powerful numbers, right? When we're talking about transgender children and adolescents. It tells us that they do know themselves. And while the average age of self-realization was around 8 years old, it wasn't until age 15 or 16 that transgender individuals reported knowing how to describe their identities. And that's important for us as providers and clinicians, because you can imagine that in those years between self-realization and outward expression, that there was a lot of internal turmoil and fear and shame, and also very little support from families or schools, because they might not have even known what was going on. So, is this a phase? There are a lot of experts in this field who have worked on identifying some key factors that are most likely to predict transgender identity as children get older. So let's go over a few. So again, it's the persistence, insistence, and consistency in how they convey their gender identity, using declarative statements like, I am a boy, or I am a girl, rather than, I wish I was a girl, or I want to be a boy. Significant distress about their body, leading to great distress when either undergoing puberty in the wrong gender, or when forced to present themselves as the gender that does not align with their internal sense of self. And while these are indicators that a child may identify as transgender later in life, they're not absolute predictors. Absolutely. So some, yes, so it varies. And is this a phase? It takes time to know whether a child's exploration of gender is a phase or something more. It's common for children to try on different aspects of gender through play, clothing, toys, and this experimentation is typically brief and often situational, such as with certain friends or in certain settings, but that is not always the case, and it can be more constant. So I thought this quote was helpful from one of the Human Rights Campaign's reports. A young gender expansive child may outgrow the feeling, but for children whose gender expansive identity has remained stable and unchanged beyond this age, insistently, persistently, and consistently, this will more than likely continue throughout life. Regardless of the eventual outcome, the self-esteem, mental well-being, and overall health of a gender expansive or transgender child relies heavily on family acceptance. Receiving love, support, and compassion from guardians is crucial. So we are going to cover that in much more detail because it is so essential. I'm going to skip over this for time because I think this is something you could all look up, but this is the basics of the gender dysphoria diagnosis. Okay, so risk and resilience. So again, I thought this was a beautiful perspective from a transgender woman who was a part of a study in 2011 that I'm going to reference later. She says, I think that there's a high level of survival instinct in trans culture in general. As transgender people, we have to be resilient. We have to be strong, because when we say, I am going ahead and making this transition, well, we know we could lose everything: our family, our children, our friends, our employment, our places of worship, our standing in the community. And even in some cases, we could lose our lives. So let's talk about what some of these risks are. Compared with cisgender youth, transgender youth report 2 to 3 times increased risk for depression, anxiety disorders, suicidal ideation, suicide attempts, and self-harm. Interestingly, social anxiety, right, makes sense in this context because these kids are worried about being found out. And these fears are genuine and can't be addressed using cognitive restructuring, right? Which might be a strategy that is otherwise relied on for social anxiety, because they're very legitimate. And research has shown that these kids are at risk, as you can see on the other side of the screen, through bullying, violence, hate crimes, discrimination, exclusion, homelessness, unemployment. And it is very well documented that these elevated odds for mental health risk can be explained by victimization experiences, as well as other concurrent psychosocial challenges that come along with being a transgender youth. So as professionals working with this population, I think it's really essential for us to be mindful and validating about the connections between these factors, and to help provide psychoeducation also to family and loved ones who might not understand that connection, because I think that's pretty common. So these are just some statistics. I'm sure you all are aware, but it is sort of sobering to see the numbers. Suicide rates, it's about 1 in 3 transgender students have attempted suicide. About 75% received counseling related to their gender identity, and 14% hope to receive it. About 8% of the trans community reports using drugs to cope with their experience. 19% have reported being refused care altogether. And these are more statistics. Sexual violence, and you can see, the yellow bars are cisgender peers, and you can see there's a dramatic difference in rates of victimization and depression and suicidality. So how does family support play a role? It has the potential to be either the most significant risk for these kids or the most significant strength. So that's pretty powerful. Children and adolescents with gender dysphoria have a higher prevalence of co-occurring mental health diagnoses. Despite this higher prevalence, researchers have found that transgender youths who are supported by their parents have similar rates to cisgender peers. So, I think that is, again, really good data for families to have as they're thinking through, what does this mean for my child, and what's going to, they're sort of catastrophizing about all of the known risks that are out there. I think it's really important for them to know that they have a lot of power. And again, a sobering statistic is that LGBTQ youth who come from highly rejecting families are 8.4 times as likely to have attempted suicide as their LGBTQ peers. And then this is a visual that also I think can be helpful for families. This organization, the Trans Student Educational Resources, has really good visuals and sort of handouts. So if you are providing psychoed, that's a good resource to turn to. So sources of resilience. I think a strengths-based approach is really helpful with this population. Really focusing on building a sense of mastery. What are the areas in which they feel self-worth and confidence? Focusing on perceived social support and membership in their community. There are such amazing ways to connect with their peers now, virtually a lot of the time. And I think really tapping into that is important. Self-advocacy, using self-advocacy as a means of self-esteem. And then access to a variety of coping strategies, of course, like making sure they have a very deep toolbox. And then evolution of self-definition in terms of both gender identity and any racial, ethnic identity. I think that allowing these kids room to explore and allowing these kids room to view the things that make them different as things that make them special I think that's one of our most important roles as well. So the W path has a very clear standard of care. So I think that would be the number one resource I would turn to if you are looking for specifics about working with this population. I'm going to cover, I'm going to sort of summarize both the medical interventions and the therapeutic interventions. So starting with young children, gender affirmation through social interventions. So do not use medical interventions with young children pre-puberty. So social interventions would include, what name does the child want to be referred by? What clothing does the child want to wear? How do they want their hair to look? What activities do they want to do? What toys do they want to play with? And then what restroom are they comfortable using? What's the locker room and dressing room situation at school? Like really listening to the child and allowing them room to choose, and then to thoughtfully assess their experience living with that choice. And we can help parents and caregivers to understand the power of just those seemingly kind of simple social interventions to really empower the child and build resilience, not resistance. Then I'm going to really quickly summarize a very large amount of information here. So gender affirmation through gender transitioning. In some children, again, the numbers vary, but it's somewhere between 15 and 30%. Gender dysphoria will intensify and body aversion will develop or increase as secondary sex characteristics develop. So, and also it's important to note that while many individuals who are transgender will need both hormone therapy and surgery to alleviate gender dysphoria, others might only need one of those treatments or neither of those treatments. So I think it's important to keep in your mind that treatment for gender dysphoria is very individualized. So for some people, let's sort of think about these in three categories or stages. So the first is fully reversible interventions. So these involve the use of puberty suppressing hormones. And I'm not going to get into the details here for there's a lot we still need to cover. But if you have more questions about the details of these interventions, feel free to reach out to me or look at any of these resources. There's really good information. So again, I'll go quickly. The second category is partially reversible interventions. So that would include hormone therapy, and then irreversible interventions, and that would be surgical procedures. And that is a staged process. That's what's recommended, to keep options open through the first stages. And then I'll just briefly say that for hormone therapy and surgery, health professionals can provide referrals for that. So if you are working with a transgender client, I would, if you've never written one of these referrals before, I would reach out to an organization or a clinic that does these assessments and referrals, and I would get some consultation. But it's good to know that your role as a mental health professional might include being a referral for one of these stages of interventions. So when we think about psychotherapy with this population, I think there's several important things to keep in mind. What is our role as a clinician? Exploring gender identity, expression, providing psychoeducation, especially with kids, like really helping them to understand what are the options? Like, I think a lot of kids don't even know what the options are. And so just giving them information, addressing the negative impact of gender dysphoria and stigma. It might be helping to facilitate a coming out process. A lot of kids who are speaking with therapists maybe haven't even talked to their parents about what they're feeling. Certainly, they might not have talked to friends or teachers or communities or churches. So we can play a role in helping them to navigate that. There's internalized transphobia that might need to be addressed. Enhancing social and peer support, improving body image, and then of course, treating any coexisting mental health concerns. So there's a lot to be sort of balancing and considering at all times when you're working with these kids. We sort of touched on sources of resilience earlier, but again, really focusing on strengths and belongingness and healthy relationships, and who are the adults in your life that are supportive of you and that you do feel seen by. What do you want for your future? What sort of fostering some of that hope. And then autonomy and competence, right? That kind of goes hand in hand with that advocacy, giving them skills. And then a few other just things to keep in mind for any adult who is working with these kids, right? We need to be really mindful of language. So all of those terms that we've been talking about. So for example, rather than opposite sex, using another gender. Things like that we might just, it just feels like second nature. We do need to be more mindful about. And do not solely depend on the client to educate the therapist about trans issues. It's not fair to have them take on the burden of that education with everything else that they're processing. So I think if you are working with a transgendered child, it is vitally important to be doing your own research and be really up to date. Remembering that the priority is physical and emotional safety and well-being. That is something that these kids often do not feel, whether it's at home, at school, in public. we can be a place of refuge in that sense. And there is no evidence that sexual orientation can be altered through therapy or gender identity, I will add. So attempts to do so might be harmful. And that goes hand in hand with following the latest standards of the W path. And then again, as I mentioned, after a thorough assessment, clinicians can write these letters of support if you have experience doing so and you feel comfortable. So we talked a lot about the importance of families. So I think one of the roles that we have as mental health professionals is fostering an affirming home environment. So these, I think, are helpful tips that I might give to parents or caregivers. So follow your child's lead. Listen, 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 listen. Be supportive and positive. Use affirming names and pronouns. Praise the child genuinely. Find genuine ways to show your love and support. Ask a lot of questions. I think adults and kids alike are generally afraid of asking questions, right? We don't want to say the wrong thing. We don't want to be offensive. But especially at home, these kids need a chance to share their experience and to feel understood. And then providing unconditional support, having a sense of humor, right? And still also setting age-appropriate limits. I think that's something that sort of across the board in mental health, sometimes parents can have difficulty with. If they know their child is struggling with something, there might be a tendency to just let everything else slide. But that is not helpful. That is not beneficial for these kids. And then provide accurate information and clarify unrealistic expectations, right? We're going to get into that a little bit more. Next slide. And protect your child from harm. So not allowing any transphobia in your home. So this is an interesting one. Time frames. So it is not uncommon for transgender or gender expansive youth and their guardians or parents to come into conflict about the urgency of a child's or a teen's need for transition of some form. And an important perspective to remember is that for kids, this all feels like it's happening so slowly. And for parents and families and loved ones, it probably feels like it is happening so fast. And this is a tension that is very common in families. So I think one of the most important jobs we can have is finding timing and a path that works for both the adult and the child. And it's a challenge. But I think sometimes parents have a luxury of time that kids don't in this situation. Then also there are situations where there are two parents or guardians with legal custody who might be in dissent about how to proceed, and medical consent needs to be reached. That can be very difficult. So that might be the role of a mental health provider. And then there are, just sort of the issues of daily life that come up, right? Like all the activities that kids are involved in, their groups of friends, like the things that make them feel normal. Sports teams, dance, theater, sleepaway camp. What happens? How do they navigate that? Do those things change? Do they have to change? what are the pros and cons, how to navigate it. And then I was also speaking with some of the psychologists at our clinic this week about their experiences working with this population. And a couple of other themes came up, I think specifically related to family dynamics and parental support. So one is, that we're in Utah, and the role of religion is very important to a lot of families. And this is a very difficult issue in a lot of religions. So that would be a very important piece to bring in to therapy, is how families can reconcile this and still provide that unconditional love and support for their child, and how kids can navigate their own, complex feelings. So that's something to keep in mind. We also have kids who talk about, going to school, and they might have some teachers who consistently honor or recognize their preferred name and pronouns, and then they have other teachers who consistently do not. And I think the stress and exhaustion that comes from having to decide every day, okay, how many times am I going to try to advocate for myself? What risk am I taking every time I do that? That is exhausting. And so recognizing that that's an experience these kids are having. Circling back to parents for a minute, someone also brought up that often as clinicians, we have a fear of parents pulling kids from therapy because a parent might be uncomfortable with the content of this work or the direction of treatment. And, even if the treatment is evidence-based and following best practices, it just might be that parents aren't comfortable. And so I think that is something clinicians are often having to, it's sort of, a tightrope walk there. And I think bringing parents into treatment as much as possible, and just providing information is very helpful there. And then I think it's important for us to recognize that we are all uncomfortable with uncertainty. So as we look at these loved ones, parents, friends, even ourselves as clinicians, right? Like we might be putting unintended pressure on individuals to just choose, like just decide. Like we want resolution, we want certainty. And as clinicians, we know that it can take time. And in some cases, it should take time for an individual to explore their gender. But I think it's important to check our own sort of anxiety or discomfort with sitting with that exploration. And then I think it's helpful for us to recognize that that's what parents and loved ones are going through as well. This is just another helpful psychoed tool, another helpful visual. I think here's some of the things that are common reactions for families. Fear or guilt that something they did might have caused their child's gender expansiveness. Shame or embarrassment about how they or their child will be judged by others. Concern that their child will be put in physical danger by presenting as transgender. And sadness, right? Sadness that their child will not have the future that they had assumed was a given for them. So there's sort of there's some stages of mourning and acceptance that come along with that. So what are some ways in which we can support these families and loved ones? So often a question that we get is, what's okay to say? Like, how can I talk to this person, this friend, this sibling about their gender? I don't know how. So I think these are helpful questions. So starting with, I don't want to make any assumptions about you or your experience. And then asking your follow-up question, like, what names or pronouns would you like me to use? What can I do to better support you? If someone asks me about your gender identity or gender expression, how do you want me to respond? And then, do you have support from friends? Or if you're a friend, do you have support from family members? And is there anything that you've seen or read that you'd like me to see or read? And then similarly, I think these are helpful tips for those loved ones who are confused about, what does non-binary mean, right? How do I approach that? I don't understand it. So I don't trust myself to have safe conversations about it. So I think these are some helpful tips there. Starting with, you don't have to understand what it means for someone to be non-binary to respect them. While you do your own learning, you can still be respectful. Always use the name a person asks you to use. That's a good place to start. And also go along with that, don't ask someone what their old name was. That can be something that can be triggering for them. Try not to make any assumptions. If you're not sure, ask and advocate. Okay, I'm gonna move on a little bit. Suggested readings. I think there are so many good books and articles out there. These are some that I recommend. And references. And then lastly, we at UCEBT, our assessment and testing program is currently offering gender affirmative surgery evaluations and referral letters. Our evaluations adhere to the guidelines for assessment as described by the WPATH. And these evaluations consist of a single 90-minute appointment with our assessment clinicians. And the goal is to support a positive surgical outcome with minimum barriers for those seeking gender affirmative surgery. So I just wanted to, offer that as a resource as well. And then there is a question, so feel free to put any questions in the chat, and let me see if I can pull it up. So let me just see, there's a question here. Any input on a young teen who is transmasculine and is hyper-focused on every new thing they see on the internet? And is absorbed in role-playing and fantasy situations? That's a good question. I think my instinct would be that they need the room to explore, because it seems like they are very curious, and there's so much information out there now, and it can be pretty overwhelming for kids and teenagers. So I think something I would recommend is just really engaging in a conversation about these things that this teen is exploring, so that you can be a source of accurate information and helping them to sort of sort through everything that they're finding on the internet. So I think encouraging them to explore, encouraging them to read, to learn is helpful, but being a source of maybe like fact checking, I think that could be helpful in a situation like that. Any other questions? how to help transgender folk who are grieving over not being able to engage in biological processes. Oh, this is a really important piece. And I think sort of similarly to what we talked about with helping families to mourn sort of the expected life trajectory or life experiences that their child might have, transgender individuals are going to have that as well, even if they are experiencing relief in a lot of ways. It is going to be, you can hold two things at once. And I think really letting them explore that and sit with that and recognizing that it's okay to be sad about missing out on some of those experiences related to your biological sex, and that it doesn't have to undermine or negate the positive experiences of a gender transition, but you can hold them both, and they're both a part of the human experience. So I think really being able to process that together is very important. Okay, and then one more question just came in. Okay, thank you, Leslie. Oh, on the autism spectrum, yes. Yes, so this was another thing we didn't have time to cover, but there is higher rates of autism spectrum disorder in this population, which is interesting, and we need to do a lot more research on. I think it's sort of lacking. So again, Beth, I will try to reach out to you individually because I know everybody has to take off. But thank you all for coming. I appreciate it, and feel free to email with any questions.